How does chemotherapy treat B-cell lymphoma? Imagine a treatment that targets the very cells causing the problem, aiming to stop the disease in its tracks. That's what chemotherapy does for B-cell lymphoma. It uses powerful drugs designed to attack cancerous B cells, which are a type of immune cell that becomes malignant in this disease. In most cases, especially with diffuse large B-cell lymphoma, the standard approach involves a combination of drugs called R-CHOP. This regimen includes for chemotherapy drugs, cyclophosphamide, doxorubicin, vincristine, and prednisone, along with a targeted monoclonal antibody called Rituximab. Each of these drugs works in a different way to fight the lymphoma. Cyclophosphamide and doxorubicin damage the DNA inside the cancer cells, preventing them from dividing and causing them to die. Vincristine interferes with the cell's ability to divide by disrupting microtubules, which are essential for cell division. Prednisone, a corticosteroid, helps by inducing programmed cell death in some lymphoma cells and reducing inflammation. Together, these drugs attack the lymphoma cells from multiple angles, increasing the chances of success. Rituximab adds a targeted approach by specifically binding to the CD20 protein found on most B-cell lymphoma cells. When rituximab attaches to these cells, it triggers several processes. It can directly induce apoptosis, which is a form of programmed cell death. It also flags the cancer cells for destruction by the immune system, especially natural killer cells and other immune components. This targeted attack helps make chemotherapy more effective and spares many normal cells, reducing some side effects. Chemotherapy is usually given in cycles, often every 3 weeks. This allows the body time to recover between treatments while maintaining pressure on the lymphoma cells. Combining multiple drugs helps prevent the cancer from developing resistance and improves the chances of remission. For some patients, especially those with resistant or relapsed lymphoma, newer targeted therapies are being explored, such as inhibitors that block specific molecular pathways involved in lymphoma growth. However, chemotherapy remains a cornerstone of treatment for most B-cell lymphomas. In essence, chemotherapy treats B-cell lymphoma by killing the cancer cells through DNA damage, disrupting their ability to divide, and boosting the immune system's ability to recognize and destroy them. The combination of drugs and targeted antibodies like rituximab creates a powerful, multi-layered attack aimed at eradicating the disease. Treatment plans are carefully tailored to each patient based on the specific type and stage of lymphoma, as well as overall health. Ongoing research continues to refine these approaches, combining traditional chemotherapy with newer targeted therapies to improve outcomes and quality of life. Always remember, it's essential to discuss any treatment options with a healthcare professional who can provide guidance based on individual circumstances.